Hi, this is Dr. Gordon Chen, Chief Medical Officer here at ChenMed. Many of y'all don't know how ChenMed got started, and I'd like to share it with you. 16 years ago, my parents were running a primary care practice here in Miami. They were taking care of the old, the poor, and the sick. My brother was in cardiology fellowship and I was finishing medical school. So my dad had a little bit of numbness on his upper lip, and he went for a CT scan to figure out what was going on. And he called me because after hearing the results, he was too shook up to drive, and he asked me to come pick him up. He found out that he had a golf ball sized mass sitting behind his nose, hence the numbness. And after a biopsy, his doctor told him that he had an incurable carcinoma and less than 2 months to live. Talk about time slowing down to a standstill. It just stood still at that moment. But my brain started racing. I was thinking, what are we going to do? Are we going to fight for more time? Are we going to live out his remaining days to the fullest? And complicating matters, I was engaged and getting married in just 2 months. And so to make sure my dad could be at the wedding, we had an emergency 24-hour wedding. And during the wedding, as I'm waiting for my future wife to walk down the aisle, my dad gets a call from a pathologist that we had contacted for a second opinion. And he told him that he thought the diagnosis was wrong and that it was a large B-cell lymphoma, which was potentially curable. Oh, best wedding present ever. So I go on my quote-unquote honeymoon with my dad to a top cancer center, trying to get him doctor's appointments and gather medical records. And as a family of doctors, we were forced to acknowledge something that we had never considered before. And it's that this healthcare system we devoted so much of our lives to was broken and working against us. Despite all of our medical training and connections in the field, we struggled to make the healthcare system clock move any faster. And each day, hour after hour, as we waited in waiting rooms, we considered things like purpose, hope, and our patients back in that medical center in Miami. Who's fighting for them? They did not have our education, connections, or resources. And we're wondering not only who's fighting for them, but who's fighting for the seniors suffering all over America. And so during his rounds of chemotherapy and radiation, my dad focused his brilliant mind on helping his patients. And as he suffered, he thought of ways of relieving his patients' suffering, like tracking visit flow and wait times, building tools to track hospitalizations, bringing actionable data back to doctors, and then also integrating with health plan data to understand key areas to focus. By God's mercy and grace, Dad reached remission, and our nightmare was finally over. But as one fight ended, another began. We channeled our suffering into a vision to reach more patients and more communities. And that's how ChenMed began. I wanted to share this with you because it was an example of how something beautiful could come out of something so painful. This is Dr. Gordon Chen. Thanks for your time.